Thank you, everybody, for coming to the 6th annual LaborFest. Very exciting. My name is Josh Frost. I am the president of LaborFest Hawai'i, although I do make a note that Leslie Lopez actually does all the work. I'm the face. Right. So without further ado, I wanted to welcome Bill. He's going to be presenting on healthcare in Hawaii as it relates to labor. So here you go, Bill. Thank you.
Thank you. Thank you. Aloha mai kākou. Hawaii is often praised as having a really great, prepaid healthcare act and leading the nation in trying to establish healthcare for everybody as much as possible, and that's true, all right, but what I have a problem with is when people say, and it's because of the history of benevolence on the plantations that this is, the way it is, because the plantations were so good, you know, and I just, that freaks me out, quite honestly, when I hear that a lot, and it's mostly by people who don't know the history of the plantations. There's really good reasons why we have good health care, but I don't give the credit to the plantations or the plantation managers as much as you'll see ILWU and the unions that brought this out of a very rocky history. So I'm going to try to correct some of that. So I have this broken up into 3 areas, and I'm going to start with pre-annexation, the period between 1850 and 1900. And of course, 1900 is a big landmark because of annexation, become a territory after that. Before that, it was the period of the kingdom and of the republic, and there was we had this awful law that I talk about a lot, and I'm not going to go into as much detail as I really enjoy doing on this, but in 1850, that's why I picked that date, right? Because that was when the people who essentially, the conglomerate corporations called the Big Five, more likely the Big One, were able to influence the legislature in the kingdom period to pass this Masters and Servants Act. And Masters and Servants Act really was legalization of slavery in many respects, right? It was a way to bring in contract labor. On our site, if you go and look at 1850, I put this up online so you can see it. In 1850, laws had to be published both in Hawaiian and in English. So I like for people to see that and what words were in fact used. But it was an awful law, and there were actually a couple legal battles over it. This is slavery, no, or not. The people who came here, who instituted this, were all people who, were the missionaries, the missionaries and the children of missionaries who prided themselves on being Abraham Lincoln type Republicans who, strongly, committed to abolishing slavery. Right? But when they got to actually running plantations, then they were, in a bind, because on the one hand, it's a bad thing, slavery. But on the other hand, it's the best way to run the plantation in their minds, right? That's how you want to treat your workers. So this is a law that sort of tries to meld those two impulses together so that, well, it's not really slavery. And yes, it is really slavery, because people who were brought in under that, this was part of the criminal code, right? And so it's the first really labor relations statute in the islands, and you couldn't leave once you were brought in. If you left, you could be hunted down by the police, essentially, right? By the magistrates, and if convicted, you would spend time in jail, and then afterwards, the term of your contract would be extended appropriately. So they did not want to, labor was, as far as the plantations were concerned, was an important resource, but for them it was, that's why I don't like the term human resources. So for them it was just like, animal resources, same thing, so, well, we can't let those people just run around in the cities and stuff, we got to keep them on the plantation, and they better not, try to run away. So failure, stopping somebody from running away was what this was all about, all right? And having them sign these contracts generally that they didn't understand in the country of their origin. And then later on finding out, wait a minute, this isn't what I thought I was getting into. So that was the Masters and Servants Act. right? And so the term that they used for servant was a term that in Hawaiian, it means outcast or pariah. And that's something that I think it's important for people to understand. It's the, anybody who knows about the structure of Hawaiian society at that time period, these are the people in early Hawaii that were, you know, captured in wars and were basically slaves. They were marked. Other people could not approach them or talk to them because they were untouchables, right? And they could be used for human sacrifice. So sadly, the people who translated the Bible, the missionaries, decided to use it whenever the word servant came up. And so, which is a bad translation, and as Puette in her dictionary points out, there's actually a legitimate word for servant that does not, you know, have that awful taste of pariah. So anyway, there it is. That's the Masters and Servants Act. And this was, again, I think most people who are from Hawaii have heard of the Big Five. There were these major corporate entities that came together. They were all basically families. And they were sharing their boards of directors with each other. So it ended up being really a big one, right? They just musical chairs when they had directors meetings. Right? And it was very much a plutocracy, an oligarchy, so that they were protecting themselves and all of their resources and everything they'd pretty much stolen, you know, and thereby owned from anybody else having anything to do with it. So these were the names. They're all family names: Castle, Cook, Alexander, Baldwin, Hackfeld, C. Brewer, and Theo Davies. And so Hackfeld later became AMFAC because of the fact that they were the one German group and couldn't very well have that running around, right? So, okay, so on the plantations, another kind of interesting thing I'm going to mention here is that under they had a Perquisite system. Now, a lot of people, it's a foreign word for them. You've heard a lot of times just the opposite. You think of this favorably because you'll say, oh, that job has perks. Ooh, cool, it has perks. You know, gosh, you know, I get a free car or something, right? So I get to drive around. They pay for my gas. Perks, I love it. You know, what are the perks? You know, woo. And so, but the Perquisite system during the early plantation days was not so nice in many respects. They did, okay, first of all, again, it's a part of the masters and servants thing. It was perquisites for servants under a contract labor system. And that's sort of like saying, oh, good, I'm a slave, they'll bring me food for free. So, oh, that's a perk, huh? I don't have to buy my food because I'm a slave and I'm not going to get paid enough to buy food anyway. So, excuse me. So, there we go. They were treated, they developed this system that did evolve. The plantations are not one thing at one time because there were different plantations. So there are different things going on. There was a lot of variety. But there was absolutely the worst you can imagine. And then there were some, you know, benevolent plantation owners, like benevolent dictators, who you can actually say, oh yeah, he was kind of a nice guy. You know? But still, the system is he was all powerful on the plantation, and the plantation managers in particular. In one account I read in 1905, I was looking for it again, I couldn't find, but it was the Labor Commission from 1905. He was saying, it was interesting, he said that a lot of the plantation managers were early recruited or decided to settle down from a career of being sea captains, right? And so they viewed the power that they had on the plantation as very much equivalent to what a captain on a ship has, which is basically life and death, right? Power over people. And so I'm going to say also the medical care has that little taint of the ship's doctor, okay, as well, because they were really, as much as possible, autonomous, you know, institutions, and they were not reliant on the town. So sugar plantations, so under a contract labor system, the plantation in turn were the masters who provided food, shelter, and medical care. Now, when we say medical care, let's also remember that medical care in the early days is not like medical care today, where you go in and they run tests and, you know, a huge amount of effort is spent to try to diagnose something. Because at that time, it was pretty much like sawbones. It was, did you break something? Show me. You know, and then I guess we can put a splint on that. Outside of that, it was very simple, very remedial type of of care for a lot of the plantations, and some of the doctors, you know, as my friend Chris Conybeare was mentioned in interviews that he has, are described as horse doctors. And maybe they were, maybe they weren't, but that was exactly the impression they left. Probably taking better care of the horses, you know, than the workers that were there. Plantations, so there we go. And this glimpse of, this is a contract that they used to recruit Chinese to come. And now you think if you follow all this, that this is a cool thing, but actually, you know, it was just a contract they signed, and there was very little you could do about enforcing any of these rights through this contract if you were the worker who's, who came over under these conditions. All right. Each immigrant shall have given him a heavy jacket, a light jacket, waterproof jacket, pair of pants, pair of shoes, pair of stockings, hat, mat, pillow, blanket. Wonderful. Okay. A present of $10 to be paid the day before the ship sails. Right? They might have gotten that, because otherwise they would have trouble getting them on the ship. A free passage to the Sandwich Islands with food, water, medical care given each immigrant. Now, free passage, there are plenty of cases where that was an argument later on that they caused what they would call riots in the early plantation days. They didn't call them strikes. Riot. Right? Particularly during the period of Chinese, when they were the first ones there, because they would be instead of getting paid, a lot of times money was withheld to pay for their passage, and the passage, that money was not being used to pay for passage. That was the Luna's little, thank you. I'll just take one for you and one for me, and what's that going to? Oh, your passage. Yeah. All right. So there it goes. The master is to pay all government personal taxes. Oh, thank you. Okay. All children to be taught in the public schools free of any expense to the parents. All right. And each man to receive $6 for each month labor performed of 26 days. Now, they had company stores in those days, and you would have things deducted if you actually got anything, and that's one of the oldest, the classic company store. So each woman could get $5, supposed to get $5 for each month labor performed of 26 days. And if you don't work 26 days, then you're not going to get that. In all cases, the master to provide good and sufficient food and comfortable house room. Okay, sounds like house, right? So, okay. In case of sickness, medical attendance and care, free. Okay. No wages during illness. Oh. Hey, wait a minute. Each immigrant to find his own bed clothing, and each immigrant upon arrival in the Sandwich Islands to sign a contract to work for such master as may be chosen for him by the government agent. You don't get to pick where you're going to go or what plantation or anything. So for the term of 5 years from time of entering upon his duties to work faithfully and cheerfully according to the laws of the country, which compel both master and servant to fulfill their contracts. Yes, and that's true. There was the law of the country. Both sides had to fulfill their contract. But it was nearly impossible for a laborer to enforce a contract under the Masters and Servants Act. So bear that in mind. Okay. So, and the work was grueling. This just gives you a sense of trying to imagine being in a cane field and having to do that kind of work for pretty much a 10-hour day. And the housing. Oh yes, that comfortable, lovely house. So if you go to the Waipahu Cultural Garden Park, which I think is a really cool place in many regards, but people know my bone to pick with them is that they should really try to have somewhere they can recreate this, but then every time it rains, they have a problem, all right? Because this is what housing looked like in the beginning, all right? And there were tons of complaints. It was unsanitary, it was smelly, it was just awful conditions that people were brought into on the plantation. So, oh boy, that's a Perquisite, huh? This is Big Island, Wainaku. And there's plenty of pictures. Here's another picture of Wainaku, because I think Grace Leonard Baker was over there and took some of these pictures. So, but you can see, be lucky that they would not be falling down. This is barracks housing, okay? A little bit later, this is 1912. And again, barracks housing was the other way you'd be housed, particularly if you were single. You would be in one of those. And so this is starting to look a lot better when you consider that you could be in a barracks. And there are a number of problems with these situations in terms of health because they were unsanitary. There's no running water. There was no place, to go to what we would call the facility. So you ended up going as far away as you could manage to get away and taking a dump, and that wasn't always so good. And so there it is. Okay, this is an interesting quote from a Hawaii Pono. If you haven't read Hawaii Pono, and anybody asks me what's a good labor history to start with, I always tell them to start there. This is, to me, #1 primary source for learning about Hawaii's, not just labor history, but basically, the early history generally. And it's a social history by Lawrence Fuchs. It is great. And as he goes through the different parts of this history, I pull some quotes from him. "I do not know what particular time is kept on the plantation," wrote the Secretary of the Board of Immigration, "but the mill clock is one of a kind that moves quickly or slowly as required." Okay. So maybe you were going to work a little more than 10 hours a day. So, and then this is sort of a follow-up on that. I was telling you earlier about a lot of sea captains influenced what was going on in the early plantations. The naval custom of flogging for disorder or insubordination continued even after it was prohibited by the Board of Immigration when? In 1868. Okay, and again, in 1885, the board issued a circular prohibiting beatings and ill treatment of laborers, but there's interesting blowback from that where plantation owners said, yeah, okay, and who's going to enforce this? Go ahead, pass all the laws you want about this. We're doing what we're going to do. And there were incidents, obviously, they refer to an incident in which a Chinese field hand was, it says, nearly beaten to death by an overseer. That's probably the Greenwell case. And if it's the Greenwell case, you can take the word nearly off, okay? Because that Chinese servant under the master of servants was killed, okay? And by Greenwell in Kona, right? And it's a famous Kona coffee family at this stage of the game. And one of the reasons that I guess they're hedging their bet on saying nearly was because that in the subsequent trial, believe it or not, the testimony was that he had committed suicide. And how has this happened? Because he dragged himself off of his cot. He'd been thrown onto his cot after a severe beating, right, in which was described by the coroner as there was no skin on his back anymore. Right? So, and then they threw him in this, and everybody said he was still breathing. He was still breathing when we threw him in his, where he's sleeping, and they found his body off of that and moving towards the door, and they said, well, he was trying to kill himself by exposure. And this is actually a Supreme Court case that's still in the Hawaii Supreme Court cases, Volume 1, Rex versus Greenwell, or Kingdom versus Greenwell, and it's used to say that, you can mitigate against being charged with murder if the person who was doing it had some hand in it, and that he was basically acquitted of murder. Right? With horrible testimony that Chinese commit suicide on trivial occasions, and it's just like Chink, to pull himself out and kill himself from embarrassment, and can't blame Greenwell. Well, there you go. So there were lots of places. This is the most classic picture of all, in Hawaii plantation days, the luna, right? Okay, the overseer, Hawaiian word that was used for overseers. And that black snake whip was standard accoutrement, for luna in the early days. The Secretary of the Board of Immigration wrote in 1897, and this is now we start to get into what about health care, okay? So this is from Hawaii Pono again. The treatment of sick laborers on the plantations is such that it practically amounts to cruelty. He explained that a room about 18 by 12 feet was used as a hospital, but that workers called it a jail. The room, he said, was in filthy condition. These sick men had to leave their quarters early in the morning and go to the hospital in order to be allowed to not work. They had to go to the hospital, the jail, they called it, right? And then they had to remain there all day until the evening whistle blows when they are allowed to return to their quarters. What was the point of that? The point of that was their biggest problem on the plantation as far as sickness is concerned was not the health of the worker, but malingerers. We'll make sure you're not faking it, right? And so you see that as one of the major reasons that they did this. Plus, they did not want to, they wanted to make sure that if he was sick, he didn't infect other workers. Because those are the two biggest concerns you're going to see that developed in the early plantation days. And one of them was to avoid plague, because there were serious plague epidemics of all different sorts. Right? And then later on, also to quiet labor unrest. So at one camp, 14 men were found sleeping in a room 15 by 20 feet. In another 16 by 20 feet, 20 men were housed. Managers docked the workers' pay without reason. The doctor who is, and this is a real interesting book that I happened upon. He actually did some interviews for the Honolulu Record, which we also have a record. But he published this novel called Beneath Hawaiian Palms and Stars, which I almost never read because I thought it was one of those, you know, crazy travel books that was written by early visitors to Hawaii. This person, okay, Edward Solon Goodhue, excuse me, was a physician. And he was a plantation physician on the island of Maui. When he retired, he wrote this book in 1900. So most of the things he's describing are the conditions that existed pre-annexation, right? So, and he's, as a doctor, this is interesting how he says, the doctor who is called in a particular case must decide whether the workman is able to go into the field. That's what he's there for, right? So, if he decides that he is, the man is fined $3 because, you know, if he's well enough to go in the field and he's pretending to be sick, he gets fined $3. Right. For his first offense, $9 for repetitions, and finally he's in prison. Put in stripes and sent to work on the road, hard labor. During that time period. It is true that the servitude is gone into voluntarily. That's what he talks about, those contracts. But that does not make it any more just. I do say that the system is morally wrong. Oh, you can say that now that you're gone. Because it permits, if it does not encourage, a curtailing of man's liberty, and it allows an employer to use towards an inferior race methods that no self-respecting white man would tolerate. So, well, yeah, he's got an attitude, right? But he did, this is where you see some of this paternalism, and that's the other term you're going to hear about a lot, is paternalism and the Perquisite system. Because the paternalism is, I'm a good guy because I would not like, I didn't want to treat this inferior race as badly as it is. When I remember in college studying in the history of the United States, the white man's burden. Okay, and generally European, right? How we looked at other races. And that's really at the heart of paternalism, is we have to take care of these poor, you know, ignorant brown and yellow people because, you know, they're not white, and, you know, after all, they can't take care of themselves. So, now what happened in 1900 was that those master and servant contracts were all declared slavery with the Organic Act, so they could not bind people, they could not imprison them in the same way. They actually were free, right? But that's like freeing slaves in the South after the Civil War. Not everybody was able to leave a plantation, and the slavery became just more subtle. Right? And so this is what we see, I think, in the early period in particular. It must be remembered that the whole plantation area, including the town, is owned by the plantation company. And although there are frequently many shops, such as drugstores, tailor shops, shoemakers, and the like, that are privately operated, they rent their sites from the plantation and can remain only as long as the plantation permits them to do so. Anyone on any part of the plantation is a trespasser unless he has the permission of the management to be there. This is one of the primary reasons why labor organization as such has little opportunity to obtain a foothold in the sugar industry. And that's a description again from Labor in the Territory. There was a guy from the U.S. Bureau of Labor Statistics called Schumacher, and his famous report in 1939 was the one that identified the interlocking directorates of the Big Five for the first time, and he's going through a lot of this early history. Since there is such a wide variation in the character of perquisites, not only as between plantations, but even as between various groups within the same plantation, an accurate evaluation of the perquisites is impossible. So, for example, in some cases, timber is cut by plantation workers. Part of it is used on the plantation and part by the workers. Many of the services provided by the plantation might be classified either as a regular part of plantation work or as a service to the laborers. So this is from a report, the same thing the Schumacher report in 1939, and trying to say, yeah, the Perquisites were abused everywhere is not the case. He was not going to go that far. Like he said, there are the benevolent examples of benevolent dictators. So, as a part of their remuneration, plantation workers receive goods and services from the company as follows. Minor perquisites can vary, the kinds of things we talk about, little heat and so forth, power, very little. And then he goes through the kerosene, depending upon the size, and then he looks at medical care, and we'll talk about that next. But this is an example of some pictures that I found of dispensaries. This is, they talked about hospitals and dispensaries on plantations. And the dispensary, when I look at that, I'm thinking of that room that had 20 people in it who were just sitting there because they were not allowed, to be at home to recuperate. And so, but dispensaries, yeah, I'm sure they did have some medicine in there. And this is Eva Plantation in 1928 hospital. Right? So now, there were, in the period between, like from 1900 to the 1920s, there were a lot of strikes. There were at least 3 major Japanese strikes. And one of the cases, almost all those strikes had to do with the housing and the medical care. These things, the perquisites, were insufficient, or they were being arbitrarily dispensed. And that's the problem with perquisites is not only is it not every plantation gets them equally, not everybody on any plantation gets them equally. And so if you try to organize or deal with a problem or bring a grievance forward, you are suddenly not going to get a perquisite. You are suddenly going to find yourself in a less attractive home or house or whatever situation. And so that's something you have to understand that was really eating them about this perquisite system, is that it was a mechanism for the plantations to control and make it so you have to do what we want or you will lose what little we're giving you, and we can make your life miserable, right, if that's what you want. So here's some interesting medical care. This is from that same section on plantations. All plantations in 1939 provide medical care for the workers and their families, but there are some variations in the extent and character of the hospitalization available. Now, again, one of the first things that I showed you about that was something that you saw in the 1880s, 1890s, up to maybe 1911 or 12. Things were really bad. But after a couple of strikes, and there was a terrible plague outbreak in 1900, the plantations were concerned. And not only were the plantations, but the Board of Health for the territory sent inspectors and said, you can't treat people like this because it's unsanitary. So fix it. So they were under pressure a lot of times to make some kind of change. Not because of their benevolence, not because they were so nice, but because, damn, we don't want another plague outbreak. I mean, killing off all the workers on a plantation, that's just going to make it real hard for us. So we don't want to do that, right? And secondly, we don't want to strike. Now, the strikes that were conducted were never so successful that they organized a union that the employer bargained with. They tended to hunt down the people who were leading the strike and deport them. Right? But in order to avoid the next strike, they would make what the smallest possible change they felt they could make in order to try to, satisfy enough workers. And see, okay, well, we're not so bad. Okay, I get it. Okay, we had a Luna who was taking money out of here. Okay, well, we got rid of him. So we'll make some small fixes, but never. It was never collectively bargained in any way, shape, or form. And they began to see that it was a good idea to have healthy workforce as much as possible because, at this time, after the Massachusetts Servants Act, were territory days, it was going to be harder for them to get labor, right? They couldn't bind them, so they had to be a lot more conscious or cognizant of that. What I thought was interesting was, here's a picture of the Japanese hospital, okay, which became Kuakini. All right, it's really nice. So you have a couple of these pictures of some Japanese hospitals and so forth in town that were not plantation hospitals. So when people were finished their terms and so forth, they moved in town. They created some really great health care. some of the plantation workers. You can't owe that one or chalk that one up to the plantations. Right? So there it is. Strong encouragement is given to workers to call at the hospital for even slight injuries or illnesses in order to maintain working efficiency. Each hospital contains a ward and separate rooms for infectious diseases. Oh yeah. Okay, they're learning their lesson. All right. So in that one of the important functions of the hospital is the care of maternity cases, and yet we have plenty of incidents before in the early days when laborers would say, well, nobody came when we, my wife was, or whatever, my mother was delivering. We just did that on our own. We had a midwife in the community, or there was nobody. So. But now, they're trying to take better care. As these years progress, most of the hospitals are well equipped with surgical instruments, supplies, and even x-ray equipment. So now we're going to talk about how this changed. And one of the big and the huge thing that happened, as you see here in this third period that I'm going to deal with, is collective bargaining. And that has to do with a very, very important event in Hawaii's labor history that took place in 1946, which is, the sugar strike. Okay, 1946 sugar strike. This happens after World War II, right? They came back. Now, at this point, the National Labor Relations Act is in effect. And probably they would have been organizing on the plantations from 1935, but because of World War II, that all came to a screaming halt. But after the war, right? And so it's, by the way, the same year I was born, so I'm a boomer. But there was a lot of things that were happening. And in 1946, the ILWU was able to put together a strike against virtually the entire sugar industry. All but one plantation was shut down as a result of this. And it was magnificently organized because these people, a lot of them had been in the war and they knew how to organize. Okay, so when they came back, they had soup kitchens set up. People were in charge of enough things to make this a very, very, very successful strike. Probably the most successful strike in Hawaii's history.
Workers sought a 65-cent per hour minimum wage, a union shop, and an end to the Perquisite system which ruled all aspects of plantation life.
Perquisites is the term that is used for the supposed free provision by the sugar plantations to workers and their families of medical care, housing, fuel, which included the utilities. The broader implications of why it was that the ILWU wanted the elimination of perquisites and those three items put on a pay basis is that it was the one area where the sugar planters could continue their control over the lives of the workers and their families.
Talks between the ILWU and the industry continued, but little progress was made on major demands. It became apparent that a strike was inevitable.
I think the union really wanted the strike in '46. It needed to cement its hold on its membership. So I really think that no matter what the industry offer had been, the industry negotiating posture, a strike would have eventuated.
We were treated like slaves.
Well, there's two very different opinions about what was going on in the 1946 sugar strike, right? So, the guy who was a plantation manager, it was inevitable. And he's one of the people who's generally considered the benevolent, plantation leader, and for lots of, good reasons. And we're grateful that he interviewed. But on the other hand, take somebody like Yasuo Akagi to nail it down. We were treated like slaves. And that's exactly how they felt. And the Perquisite system was a major issue. It was the one that they actually had the most probably success on. There was certainly a wage increase. They were also trying to get union shop, but they weren't able to get that. But they were able to, and when I say end the Perquisites is not right, it's convert the Perquisites. That was what they wanted to do, to cash. So that, and then the union has a contract for it, because this produced a real contract, which means if you weren't getting it, you could grieve. The union could grieve, could do something about it, right? And you couldn't deny it just because of favoritism. So the whole idea of using this as a mechanism of worker control was now finished by the 1946 sugar strike. It was a huge event. And so there. With the abolition of the Perquisite system, workers pay specified monthly premiums, and the companies finance all additional costs in the program. Each plantation operates its own health plan fund. In the early days, that was what was done. There's an interesting study that was done and paid for by the ILWU in 1952. It's called Medical Care in the Territory of Hawaii. It's an amazing study. ILWU commissioned it, and this is some of the stuff that was in there talking about what was before and what happened as a result of that strike. And one of the things he has in here, I think, is, the current temporary plantation plan is a continuation under new union management agreement of the old medical system operated by the companies as a Perquisite. But it's not a Perquisite anymore. It's a matter of contract, union contract, that you can do something about. Provide to all plantation workers and family members accepting children over 16, with services provided by medical personnel employed by the companies in dispensary and hospital facilities, either owned or paid for by the companies. Right? And I think it was by about 1950, from what I've seen in a couple of other articles, that the hospitals and so forth that were on the plantations were all pretty much gone, were all shut down, and you had, more traditional types of things developing as a result of this. This is all a result of the 46 sugar strike. This is actually the language from that first contract that talked about, we don't want to stop medical care. We want the medical care, but it's got to be understood, A, you're going to keep it the same way as you did it before, if not better, and then, so you can do something about it under your union contract. In case an employee becomes delinquent in the payment of dues under the medical plan, a written notice will be given to the employee. So again, what they were having to pay for the medical plan was the conversion of the Perquisites into cash. So at least 15 days before his membership. So you can't unilaterally or capriciously terminate their medical insurance. That's an important thing to understand. Okay. And I put these last two things in here. It'd be an interesting way to do a whole program just on it. And what happened after from the 50s onward, when you start to see the development of the groups, HMSA and Kaiser, as most people in Hawaii know, you have these major medical groups that started and were started up. These were not started up by the plantation. Right? Chris was telling me before how important Kaiser, ILWU, and particularly Aquan, was to the beginning of Kaiser over here, Kaiser Permanente. So the 5 doctors who started Straub Clinic, were doing things in town. Right? It was not a plantation welfare system. And HMSA, likewise, we have the development of the HMSA. You notice in 1946, it joined the National Blue Shield Association, and this is because of the impact of the sugar agreement in ILWU. We're able to start negotiating where people would be paying premiums into a respectable organization. Right? And their major medical plan in the 50s, so forth, finally increased their membership along. So I was told to stop right around now, and I think I just about pulled that bugger off.
Good evening, brothers and sisters. Really wonderful to be here. Healthcare in this country has really been in a state of crisis throughout the neoliberal era. And there's a lot of, everybody uses the term neoliberalism nowadays. And so, when I'm talking about neoliberalism, I kind of describe in a period that began in the late 1970s that was characterized by intensified attacks on unions and on public goods, the goods that were provided as a matter of right through public provision rather than bought and sold as commodities, and a lot of privatization and struggles to cut public programs began to characterize our political moment. And the results of that were the sort of massive rise in inequality throughout the world, the globalization of labor, so that our workers were now competing not only Ford versus Chrysler, but Ford workers in the U.S. against Ford workers making 1/10 of their wages in other countries, and the marketization of almost everything that could be turned into markets bought and sold. So I also like to call that period my miserable life as a trade unionist, because basically, I got my first full-time job in 1972, which is kind of unique because that was the period where the blue-collar workers had the highest wages in history. They've stagnated and gone down since then. And I joined the union that really formed me as a trade unionist, the Oil, Chemical, and Atomic Workers Union, in 1979, about a year before Ronald Reagan busted the Air Traffic Controllers Union, and things really turned to crap. And so, that was sort of the broad kind of social parameters that really began to create a crisis in healthcare. In addition, the healthcare had become a much larger part of the economy. It had really expanded from these little dispensaries where they would have to decide whether to chop your leg off or put it in a splint, into a much more sophisticated and expensive standards of treatment. So the way to look at healthcare, I'm told, and I'm not a policy expert by any means, but the experts say you look at it like a three-legged stool, and you look at cost, access, and quality as sort of the components of healthcare. So when you look at the American healthcare system, and you look at how much it costs, you quickly find out that it costs 2 times as much as the average highly industrialized countries, and that it has been increasing systematically throughout this whole period at 2, 3, and 4 times more per year than our wages have increased. Every year, maybe our wages go up 1%, 2%, 3%. Healthcare is going up 2, 4, 6, 8, 10%, year after year after year throughout this entire period. And every year, there's a survey called the Millman Survey. It's a consulting company that studies a lot of employer-based healthcare. Every year since they've been doing their survey, the workers' share of how much they pay for healthcare has gone up. So that's sort of the cost issue. Then you look at access, how people can get healthcare. Turns out we're now 7 years into the passage of the Affordable Care Act, and the Affordable Care Act radically cut down the number of people who had no insurance. But there are 28 million Americans today who have no health insurance whatsoever, no insurance. There are also tens of millions of more Americans who think they have health insurance until they get sick, and then they find out their insurance is so inadequate that it's almost practically useless. It doesn't keep their families from bankruptcy and financial crisis. Now, this 28 million could have been cut down by several million more if the 19 states that refused to take federal funds to expand Medicaid benefits to their own working poor citizens had done so. And that's, their reasons for refusing that money were purely ideological. They had nothing to do with any internal state reasons why they shouldn't accept that money. And that's just a cruel and vicious side effect of the toxic politics that we're all living under. So that's access. Then you look at quality. Turns out the Commonwealth Fund says that we have the worst quality of health care in the entire developed world. So that, we're paying twice as much for our health care, but it's the worst in the developed world. We're ranked 26 out of the 35 OECD countries in life expectancy, 29 out of 35 in infant mortality. And that doesn't even account for the inequality that's built into this healthcare system. So if you go to some neighborhoods in the city of Baltimore, near where I live, They have infant mortality rates that are worse than in the West Bank of Palestine, which has been shut off by and walled in by the Israeli government for decades. So, you know, if you are a rich white guy and you need a new heart, America, the U.S. is maybe not the worst place in the world to get health care. But if you're a poor woman with diabetes in South Texas, this is a pretty miserable country to have to rely on for health care. So you have a quality that is worse than anything, or any other industrialized country. So you don't need to be a PhD, Harvard-trained social scientist to kind of figure out what every country in the industrialized world has already figured out. That the reason we have such a dysfunctional system in the United States is that healthcare in the United States is not treated as a public good. It's treated as a commodity. Its fundamental purpose is to be a business that generates profit for various people who extract profit from that system. And from that perspective, there's nothing wrong with the healthcare system. If you look at healthcare as a business, it's a damn good business. It's the biggest, most profitable business in the history of capitalism. And so the discontinuity in the system is that most people believe that healthcare is a public good, that we have a right to healthcare, we have a right to healthcare as human beings, and that's why the system exists, but the system in fact exists to make profit and to generate profit and power for those who control its levers. So if you believe that healthcare ought to be treated as a human right, it's pretty easy to figure out how to do it. As I said, every other country in the world pretty much has done that. The broad kind of definition of the style of healthcare that treats healthcare as a human right is some kind of a single-payer system. That sounds kind of complicated, but it basically says that somebody, usually the government, collects all of the money that we need to spend for healthcare through some system of fair and equitable taxation, and distributes that money to the people who provide that health care in a way that is rational and makes sure that there is a single standard of care for everybody covered in that society. And it works. I mean, we have a system called Medicare. When you're 65, you have a right to health care. And there's a single payer that has collected that money throughout your working life. You and your employer have contributed into this system. It's called a social insurance system. And you're entitled to draw from that system when you're retired. And everybody has the same access to that system. Everybody has the same right to collect it. So that's why when we talk about single payer system in the U.S. context, many people say we want to expand and improve Medicare for everybody in America from the cradle to the grave. So we want to expand Medicare because there's a lot of holes in Medicare. We want it to cover everything, and we want it to cover everyone, everybody in, nobody out, from the time you're born to the time you die. And that's the sort of simple vision that we have as healthcare justice activists. And, you know, we could there's a lot of technical things about how to construct these systems. France is a little different from Germany, you know, but really those, you know, the basic outlines of the system are pretty easy to figure out. You know, our system, and I'll just say this very quickly, maybe historians can come back and talk to this. It's really rooted in this kind of post-World War II period in labor relations that ended up with this weird system where most people's health care in this country is linked to employment, which is unlike almost everywhere else in the world. And, you know, part of this is that we emerged from World War II with a really powerful employer class. They had, you know, made a lot of money in the war. They had not been discredited by their association with fascism, like the European employer classes had been discredited. They had a lot of power, and they were getting ready to use it as the war ended, and they had made profits throughout that period. And on the other side, you had this very feisty labor movement. And we talked about the sugar strike in 1946. 1946 was this massive strike wave around the country. People were just, you know, everywhere. Were going out, confronting Capitol in the streets. And there was this struggle that was going on. And basically, the workers lost that fight. We were not obliterated, but employers kind of reasserted their control in the late 1940s through a series of legislative and on-the-job victories against workers. There was a law passed called Taft-Hartley, which really changed the landscape for how we could what we could bargain for, how we could fight the bosses, and a series of other laws that kind of reversed the forward movement that the working class had made throughout the 1930s and the 1940s. And so the next thing that had been on our agenda as a working class in the 1940s was to establish the sort of rights to health care and rights to decent employment, the rights to a job, that a number of other working class movements around the world actually established during that period. And we lost that fight. We never were able to institute a national health care system in the 1940s, but we were strong enough to kind of get a second best system, which was a system that linked it to employment. So we weren't able to get the U.S. government to treat health care as a right, but if you worked for General Motors, or if you worked in the sugar in Hawaii and were represented by the ILWU, or you know, a lot of other places, you had pretty good health care, and you had it pretty much guaranteed for your entire career, and then eventually, you know, through your retirement and everything else. And so we created what historians have called a private welfare state. People in France and Sweden and around the world had created a real social welfare state where they had guaranteed rights throughout society. Our welfare state was privatized. It was linked to your employment relationships and other relationships. And there's some problems with a private welfare state that we found out about over that period of time. First of all, it's very fragmented. So you work for General Motors, you work for IBM, you work for that mom and pop candy store down the street. You all have different types of benefits, different relationships to things. And that means that when I'm having a problem with my health care benefits, because my boss just said, now I got to pay for half of it, all these other folks don't really have the same problem that I have. So it's much harder for us to work collectively together to defend and to advance our interests around these issues, because we're all fighting slightly different fights, and we can work in solidarity with each other, but it's a very different dynamic. So it's much easier, and we saw this throughout the 1980s and beyond, for an employer to take away your retiree health care than it is for Medicare to cut everybody's access to Medicare, because we're all in that boat together. We all understand our common interests. And the other problem is that it's linked to employment. It's not a right, it's a benefit. You get health care as a benefit. And when it's linked to employment, that means that when the plant shuts down, or they bust the union, or a company goes bankrupt and gets bought out by somebody else, all of those benefits, they don't survive necessarily. And that's what, again, what we found out during, as neoliberalism took hold and deindustrialization set in. We found out that these lifetime perquisites no longer existed for more and more working people. And so American politics throughout this whole period has really been littered with mostly failed efforts to address this issue, to move us into the 20th century and into the 21st century regarding healthcare. The most successful one was in the mid-1960s. There was a big explosion of social movements in the 1960s, and one of the results is that we established the Medicare system, which gave the right to health care for anybody over 65, and the Medicaid system, which gave some rights to health care for people who were poor and had no access to employment-based health care. Not as expansive a right as Medicare, but nonetheless a right. These are the things that the people who hate the idea of public goods call entitlements, even though they're really social insurance programs. We all pay for them together, and we all draw from them collectively. But most of these fights during these periods were defensive. And then finally in 2010, as this crisis just played out and played out, we passed, and the President signed the Affordable Care Act. And this, you know, was a historic expansion of access to health care in this country. And it does many good things. It expanded Medicaid access to those states that chose to accept the federal money to, you know, millions more of working poor folks around the country. So, you know, people are alive today because this act was passed. I have no question in my mind. It began for the first time to regulate private health care insurers. It was a lot harder for them to sell fake insurance that didn't really cover anything. They were required to cover people who had so-called pre-existing conditions. Kids up to age 26 were covered. A number of other regulations were instituted. And people had the right now to purchase private insurance policies through state exchanges. And there was some standardization of those rights. But the ACA was intentionally designed from the beginning not to disrupt the broad for-profit healthcare system. In the labor movement, we like to joke that this was, you know, that they made the error that every shop steward learns not to make, which is bargaining against themselves. They thought at the beginning, you know, we know that they're not going to like this, so we won't even ask for this. We'll ask for what we think they're going to like. And you know, what happens when you bargain against yourselves? The other side realizes that you're weak from the beginning, and you don't even get what you think they want. You're going to get even less than that. And that was sort of the dynamic that happened around the Affordable Care Act. You know, they intentionally said we're not going to question the power of the private insurance industry and the other profiteers in the medical industry. We're just going to try to, you know, work around that. So you're going to try to take this round peg of the right to health care and pound it into this square hole of medical profiteering. And that's why we have this sort of distorted system. Healthcare is still a commodity in our country. And the Act really incorporates a lot of the inequality and instability that's built into our healthcare system. You have these exchange-based insurance, which is basically a map to the race to the bottom. So you have what you call metal bands for insurance. You have platinum, gold, silver, and bronze. So if you get a platinum plan, it's supposed to pay about 90% of what your expenses are, and then gold is 80, silver 70, bronze 60. You know, so if you have lead, yeah, there's lead. So who's going to buy a bronze plan? It's people who can't afford anything other than a bronze plan, in general. I mean, there's always dumbass people who do stupid things, but in general, the people who buy bronze plans are the people who can't afford platinum plans. And then, who's going to be most vulnerable to a plan that only pays 60% of your health care benefits? It's going to be the people who have to buy the damn plan. And so, you know, this is the race to the bottom. And, you know, the problem from a union perspective is that most union plans, when this act were passed, were like platinum-type plans, paying about 92% of people's costs. But the standard that the Affordable Care Act set for public insurance exchanges was a silver plan at 70%. So that gave the sort of signal to the bosses about where our health care was going to go. It was going to go from 90% coverage down to 70% coverage. Non-union employers began to adopt plans that were designed at the silver level, and you know, as unionists, we were then set with this impossible task of struggling to maintain a level that was, you know, radically higher than everybody else around us at a time when our density was decreasing. So it created this, intensified a race to the bottom that was going on already. And you know, those of us who've been running this race realize that there is no bottom. You know, you can always go one step lower, and that's the direction that our healthcare is heading into. So it undercut decent employment-based benefits. It institutes a tax that has not been implemented yet, excuse me, called a Cadillac tax. We call it a Chevy tax because basically it's a tax against decent employment-based benefits. There'll be a 40% surcharge on the cost of benefits again that exceed a certain number and that continue to go up at a rate higher than the average costs. And you know, this is just gonna, we've seen this play out in negotiations already. It's gonna force employers to drive things down. We went into national oil bargaining 2 years ago. The employers basically said, we will never pay this Cadillac tax. We will do everything that we can to redesign our benefits to avoid paying the Cadillac tax. And that's basically, you know, pushing our benefits downwards. It also encourages really bad healthcare policy in terms of setting up what are called narrow networks, which means, you know, networks where with very few providers, where the insurer then has sort of the power to force these providers to work cheap and restricts people's access to decent health care and allows people to be denied health care. And the other thing that this, the ACA encourages is the expansion of what are called high deductible health plans, which are exactly what they say. You pay a lot of money out of your pocket before you're ever given any coverage for health care, which is supposed to somehow discourage you from using the health care that you need. So these are bad ideas from a health care policy. If you want a health care system that provides health services to people, it's a bad idea to have a high deductible plan, because when someone gets sick, they're not going to go see the doctor until they're desperately sick. And then it's going to cost a whole lot more, and their illness is going to be made a whole lot worse. These are just dumb things that happen when you have a profit-based health care system. So, by the way, you know, in the midst of this dysfunctional system, if you inject what's called a public option into this mix, we don't think it's going to really change any of these dynamics all that much. A public option says that you should have the right, in addition to any private insurance plans that are offered for sale in where you live, you should have the right to buy a public health care plan, probably supposed to be like Medicare or some other public health care plan. And that plan will compete with these other plans in a market system. We think that, you know, while it may provide some stability for some insurance markets, because some insurers threaten to leave the markets, creating, you know, a crisis where people have no access to health insurance, that public option in the middle of a bunch of sharks really has no ability to survive. The people who there's a phenomenon called adverse selection, where the sickest people will buy the plans that provide the best coverage, thereby causing the cost of those plans to explode. So if everybody who's sickest needs the public option because they can go see good doctors without a lot of copay, that's going to have to pay out more and more money. It's going to get more and more expensive. And if you're really healthy, you're like, oh, well, the public option is $1,000 a month, and this one here is $300. It's got a high copay, but I never go to the doctor anyways. I'm going to save $700 a month. So, you know, all of a sudden you have this massive adverse selection problem in the system. So we don't think, you know, public option is a viable long-term solution to the healthcare crisis. It might, you know, soothe some of the bumps, but it doesn't really get us much closer to treating healthcare as a basic human right. So in 2009, we launched a labor campaign for single payer, and our mission is to really promote the voice of working people in these healthcare debates, and to move the labor movement back into the forefront of the fight for healthcare justice, to put the labor movement back on record as supporting a single-payer solution to this healthcare crisis, and to get the labor movement to put the kind of resources and organizing capacity that only labor can do. We have basically two principles. Number one, that healthcare is a fundamental human right. It's not a commodity. It has to be treated as a public good and administered through a single-payer system. And secondly, that to win this right, what we really need is a powerful social movement against consolidated economic power. That we don't need a bunch of smart policy wonks. We need people who know how to fight corporate power, because the problem that we're facing here is not that we don't know how to get to the solution. The problem is that we have a gigantic medical industrial complex that stands between us and that solution. And we need to build the power to take that down. And that's why labor has to be in this fight, because labor exists to fight corporate power. And we have to understand that. We also say that there's 3 reasons why this fight is important for labor. Number 1, healthcare is economically unsustainable at the bargaining table. We can no longer bargain effectively for healthcare. This Millman consulting group, which tracks the cost of employment-based healthcare, has said that in 2017, the average healthcare cost for a family of 4 covered by a decent employment-based policy is $26,944 a year. And out of that, right now, employers are paying an average of $15,000 of that amount, and the workers and their families are paying about $11,000 of that amount. So I used to do negotiations all the time, so I always divide these numbers by 2080, which is the number of hours a full-time worker works in a year. So $26,944 is $12.95 an hour. That is, that's how much it costs on average for a working class family for health care. So when you talk about people fighting desperately for the right to make $15 an hour, just add on top of that another $13 an hour for health care, and understand that we cannot bargain those kind of dollars for working class Americans. We've got to come up with something different. We've got to take health care off the bargaining table. Second reason is it's politically unsustainable. Healthcare has gotten wrapped up in the politics of resentment, this sort of appeal to the worst values of the American people. So, you have these attacks that went on, for example, in Wisconsin, when they took away the bargaining rights of the teachers and public workers in Wisconsin. And, people were going on the radio saying, those damn teachers in Wisconsin, they get all their health care coverage for free, and you have to pay $200 a month for your health care coverage out of your paycheck, and you have all these deductibles and co-pays. Why should your taxes be going for the health care of these lazy teachers and public workers? So this resentment plays out politically. We've seen this state after state using that kind of attack, even in the private sector, when private sector workers go on strike to fight and to maintain their health care benefits. The employers will compare what they have to what the people on average in the communities have, and they kind of break the solidarity that people have with their communities. When we organized public workers in New Jersey in the 1980s, we went to the communities and said, our members are getting food stamps while they're working for you. And people saw that as an injustice, and they wanted to correct that. Now the other side is going to the communities and saying, those sewer workers may have better health care than you have, and you work on Wall Street. What, is that right? We got to do something about that. So it's politically unsustainable to continue to bargain for health care coverage. We've got to come up with a better solution. And then finally, if you believe, as we do, that we need to revitalize the labor movement, that the labor movement has become marginalized in this society, that it has to have a vision that makes it relevant to working class Americans. The fight for the right for health care for everybody in America puts labor back in the forefront of that movement. It's fighting for everybody's health care, and it's a way to sort of position our movement as a movement that speaks on behalf of all workers and not just on the small section of workers who still have the right to union representation. So we really believe that this is central to this project of rebuilding a labor movement in this country. We also understand that we face some significant pushback within the labor movement around the issues of health care. First we have a lot of unions that still have what are called Taft-Hartley funds or health and welfare funds. These are union funds that are jointly administered by unions and employers, that negotiate set contributions from employers and provide healthcare benefits. These are usually some of the best healthcare benefits that working class Americans can expect in the country. And they tend to be somewhat conservative on how they view healthcare reform because they're very proud of these funds and what they've done for their members, and sort of don't see a role for these funds in a single payer system. And so that's an issue that we really have to confront. Now, many of these funds are in crisis right now because of these numbers that we're talking about, and are eager to think about solutions. And even those that aren't in crisis are often one economic crunch away from a crisis. So New York City building trades, for example, are doing quite well right now. They're building stuff all over the city. Their funds are doing well, but the next major recession that hits, those funds will be in crisis, and the people need to understand that. And so what we've been trying to do is develop sort of this dialogue with those funds, and ask them to imagine what they could do with those funds if they didn't have to allocate $10, $11, $12 per hour for every hour that their members work, just to provide basic health and dental and prescription coverage for their active and retired members. If they could, integrate that money into a publicly financed system and cut that amount by half or even more, that they could then put that money into propping up their pension funds, which are currently in crisis in many of these unions, and providing other benefits that provide a real union advantage. Wraparound benefits that aren't covered under the health insurance plan, child care, elder care, legal services. There's hundreds of things that could really enhance the lives of their members that the funds could address if they weren't trapped down by that. So that's one area that we really have to take a look at. Also, some public employees around the country still have pretty damn good health care, and they think it's going to last forever, and it's really hard to kind of confront that issue with them sometimes. They're worried that the public system will end up with worse health care than what we have. So in Vermont, there was a big fight to enact a single-payer system a few years back, and the Vermont State Employees Association kind of grabbed that by the tail, and they went to their members and said, you know what? The only way we're going to be able to hold on to the great health care we have is if we fight to expand it to everybody in Vermont, if we make it a right for everybody. Because we're not going to hold on to this forever. We have a few years to do this in, and we need to be on the front of this fight. And we need to make sure that the plan that we end up with is as good as the one we have. And the people of Vermont will thank us for that. And so that's sort of a way of reframing that issue. And in fact, that fight kind of floundered, and now there's a governor in Vermont who actually wants to, by legislation, limit the health care benefits of those workers in Vermont. So they were very correct to do that, and that's sort of the approach that we want to talk to with public sector workers. Thirdly, a big pushback is the issue of what happens to workers who will lose their jobs when we transition to a single-payer system. And workers will lose jobs during this transition period. Every doctor in America has at least one employee whose job it is to argue with insurance companies. And every insurance company has one employee whose job it is to argue with that person. So there's all of this waste and inefficiency that goes around a fragmented, profit-driven system. And that system is built to enable profit-taking, but all of that waste and inefficiency also employs workers who, through no fault of their own, will be affected by a change. We believe that when you enact a massive social change that affects the livelihoods of working people, that there is an obligation to ensure that those people have a just transition. So we call for a real commitment to transitional benefits for workers who have to be displaced as a result of this. And there will be incredible new employment opportunities in a healthcare system that's talking about delivering health. We'll need people to go out into the communities, as they do, even in places like Cuba, which have, almost no economic resources to provide health care, and identify people who have developing health problems, and work on diabetes and opioid abuse and all of these other public health plagues that are affecting our life expectancy. So there will be new jobs that develop out of this, and we're calling for full wage coverage, wage replacement for up to 4 years for displaced workers, full education benefits, and retirement benefits. And we think that's the only way you can make these transitions. Or else the working class will go to war against itself. Those who are worried about losing things will go to war against those who are trying to advance their own interests. We're never going to win on those terms. And then finally, the final pushback that we have is that some unions, and some more than others, are often reluctant to disrupt their relationships with the Democratic Party establishment. Right now we are fighting this vicious Republican Trump establishment that is, insane. But let there be no doubt about it. To win this fight, ultimately we're going to have to come up against the sort of corporate power that has also ensconced itself within the Democratic Party. And unions, for a lot of reasons, are reluctant to confront that. And they are multi-issue organizations. They have to concern themselves with the full range of issues that affect their members. And it's hard sometimes to really piss off those politicians that you rely on for a number of different things. And so we understand that there has to be sort of a strategic approach to that thing. But there is almost a knee-jerk reluctance on the part of many unions, especially the higher up in the union hierarchy you get, to disrupting those relationships. Those are all issues that we have to deal with. But we are in a unique political moment, brothers and sisters. 1 year ago, we were in a presidential campaign where we thought that quite honestly, that the next president would continue the Affordable Care Act, and we'd be fighting these sort of fragmented battles about how to move out of that situation. We were wrong about who was going to be the next president. But I will point out that the person we thought was going to be the next president was saying that we will never ever have a single payer system in this country. And that we had a big fight last August at the Democratic National Convention over the platform around health care that we lost, that we came there and demanded. 82%, I think, of all Democrats believe in Medicare for all, but the platform committee would not include that in their plank. We lost that fight. 6 months ago, we were looking at this President Trump and their Republican Party hegemonic control of all three branches of government, the Supreme Court, the legislature, and the presidency, that we thought that the Affordable Care Act was going to be immediately repealed, throwing tens of millions of people out on the streets, and that then the attacks would proceed throughout the entire social insurance system, Medicare, Medicaid, children's health insurance, food stamps, all of the sort of indicators of that provide a healthy life for working class Americans. We thought we were going to be facing that. And then 2 weeks ago, Senator Bernie Sanders introduced the Medicare for All bill. And he was, by the way, he had done that in 2012, and he introduced it, and it got maybe a line like this in the New York Times on page 11 or something, and not a single other senator stood next to him when he introduced that bill. Well, 2 weeks ago he introduced the bill, and there were 16 other U.S. senators in the room with him when he introduced this bill, including several who want to be president, who want to run for president in 2020. So the ground is beginning to shift beneath our feet. The latest AP poll showed that 62% of all Americans believe that health care should be treated as a right and that the government has the responsibility to guarantee people's health care. That's a 10-point shift in like 6 months. 10 points in public opinion in this like 6-month period. So like since the 1940s, we've been fighting to make health care a right. And in a 6-month period, bam, all of a sudden, a majority of Americans are with us. So I think a couple things have happened. Number one, Senator Sanders had a lot to do with it. He ran for president last year. Every speech he gave, he talked about Medicare for all, that health care should be a right. People understood it immediately. They responded to that issue. It resonated with them, even those who didn't support him completely related to that issue. And then secondly, and I think even more importantly, the Republican attacks on the Affordable Care Act and on all of these public health care programs has really awoken the sleeping giant. The American people have really begun to understand that, that what health care means to them, what the role of government is in providing health care. They expect that health care ought to be treated in a right, and they were outraged when they began to understand what was going to happen to their health care. And as their outrage grew and as their participation and involvement in this issue grew, these grassroots movements emerged. People have heard of Indivisible. I don't know if they're active in Hawaii, but that was formed by Democratic staffers, basically just to say no. It was supposed to be no content to it beyond just trying to stop the crazy Trump policies. But the people who came together around that, they started thinking about what they really wanted. And people began to realize they weren't really fighting for the right to buy some crappy health insurance policy on a public exchange. They were fighting for the right to health care. And so they started screaming not only at those Republicans who were going to vote to repeal the ACA, they were going to the Democratic town halls and saying, we want Medicare for all. You know, so a senator would stand up in town hall meeting, I will do everything I can to stop the ACA from being overturned. And people would say, well, we want Medicare for all. What are you going to do about that? So we have this powerful grassroots movement. I believe that those 16 senators didn't show up at Bernie's press conference 2 weeks ago because the Holy Spirit suddenly descended upon them and enlightened them about the needs of the American people. They showed up because when they went home over the summer, that's what they heard from their constituency. And they understood that if they wanted to be seen as leading their constituency, or if they wanted to run for president and get a nomination through the Democratic Party, that they had to get to the front of this fight. So this is a watershed moment, I think, for our movement. And that said, it's important not to be overly exuberant about where we are. The Republican attacks will continue. We're going to have to learn how to play both defense and offense and to beat them off. They're going to probably try one or more times to do a full repeal of the Affordable Care Act, and then they're also going to try the death by 1,000 cuts attacks on programs where they try to chip away through every budgetary and other reason to undermine public health care. And we also have to understand that we face formidable barriers to winning. Support right now is broad, but it's untested. I like to talk about it as a sort of moment when you're organizing in the union drive, when you've got a lot of excitement among the workers, but you haven't gone public yet. The boss hasn't found out, so they haven't started their counterattack yet. And believe me, they will counterattack. They will do everything that they can to hold on to this profitable system that they've created in this country. And we've got to be prepared to conduct a fight on multiple fronts to win this fight. You know, this is a moment where we have to do kind of the deep organizing that will inoculate the American people against the attacks that will happen from the other side. And the attacks, I think, will come in a number of areas. Number one, they're going to try to claim that you don't want a government bureaucracy running our health care. They'll say, look at the Department of Motor Vehicles, how, you know, you want that to be your health care system. You know, and that has some impact. I think it has a whole lot less than it used to, because guess who runs everybody's health care now? A bunch of freaking bureaucrats. So it's, you know, most people have a horrible experience, you know, getting free certification and everything else. So it doesn't have the resonance it might have at one point. But there is something that's called loss aversion, that people tend to resist losing more than they risk winning sometimes. And, you know, I think the only thing that Americans often hate more than their insurance company is the prospect of being without an insurance company. And so that the other side will play on that sense that maybe you're going to lose something as a result of this. And then finally, they're going to go after cost. Cost of healthcare and financing healthcare is complicated. I know the panelists, I think, are going to address some of these issues. It's a very complex system. There's all kinds of, people don't really understand how much their health care costs and how much they're paying. And when we replace a fragmented private insurance system with a social insurance system where everybody's paying into it equitably, you know, taxes are going to go up. There will be gigantic tax increases, mostly for wealthy Americans. But look at how they've manipulated the estate tax issue in American people. The estate tax only affects, this is what, you know, if you die, there's a tax sometimes that the people who inherit your wealth have to pay. That goes into the general good. The federal estate tax now only covers, I think, 0.5% of all estates. You have to have like more than $6 million. Am I right on that? Something like that. 5.5. Before the tax is triggered. So almost no one is covered by it. But you know, the death tax is this huge political issue. You don't want to pay a death tax, you know, you got to vote for me. So, you know, this tax issue is going to play out. We have to be very on top of that issue and aware of that issue. We got to sit down with the American people and have them do their kitchen table economics and understand what they're paying and what they could pay and what they're saving under a single payer system. And that's very, it's very crucial. And we have to work to scale up this movement because we are fighting, you know, massive corporate power. We're not going to win this in the end by bake sales. We're going to win this by putting the kind of resources into it that we would put into any other existential fight that we engage with. And that's particularly so for the labor movement. The labor movement has to make this into a powerful central part of their program. We like to joke in the labor movement that we have to move beyond resolutionary politics. We don't need to just pass resolutions. We need to commit organizing resources and real money into this fight. So here we are, I think, at a crucial moment. I think we're at a time where the labor movement and other social movements really need to step up and move this fight forward. I see healthcare as a wedge issue into a whole range of social justice fighting. The power that we build to win health care for all in this country will be the power that we can then use to create a living wage for everybody in America, to create the right to education and the right to housing and the right to organize a union and bargain collectively for all Americans. So this is a central issue for the American people, and we need to prepare now for the fight that's ahead of us and keep our eye on the prize. Thank you very much.
Mark Dudzic talked about the efforts for single payer in Vermont and also in California, which failed. And I just want to make a couple of comments about that, because the way that single payer saves money is by being much simpler administratively. And you can then use administrative savings, which are savings for both the providers of care and the payers of care, the insurance companies. You can use those savings to lower the prices paid for health care. And that's where you see big reductions in costs. You can, you know, if you can pay a hospital with a global budget and eliminate their billing and collections department, that billing and collections department is 15 to 20% of the hospital budget. You can cut that right off the top. And with administrative savings, you don't get them until you get everyone in the same system. As long as the doctors and hospitals have to deal with the current system alongside of some new program that's only a part of what they deal with, they have to maintain the administrative structure to deal with everything, and there are no savings to be achieved. Once you get it to a full system where everybody's in, then all of a sudden you have the administrative savings that are achieved immediately on implementation. Both Vermont and California looked at trying to expand what they were doing to everybody, but they couldn't achieve the savings that would come from a single system. So the result was, you're now covering more people, you're doing the same thing you're doing now, and it's going to cost more. They did an economic study of the California proposal, which they did this in a very logical way. They say, it's costing California $385 billion right now for health care. If we were to expand what we're doing now to everybody, it would go up to $404 billion. However, if you get the administrators of single payer, you would knock $18 billion off that, and then you end up with about a 10% savings from where you started out with. The media picked up on the $404 billion, and they said California's proposal will cost $404 billion, and you got to tax everybody to do that, and they managed to kill it with that. They never even mentioned the savings that were included in the study. You have to get everyone into the new system, and then the savings are immediate. Thank you.
I'd like to put a point on some of the things that were said. If it wasn't obvious to everyone in the room, healthcare is a class struggle. And from Dr. Puette's presentation, you could see that healthcare as a concept came about because of the class struggle. Workers fought for that. And because workers fought for that and created unions that created groups large enough to drive market, HMSA and other insurers were formed from that. Workers had to fight for health care from the start. We have to fight for health care today. And in fact, we are fighting the same people. So first of all, we need to dispense with illusions here. We don't have friends. We don't have friends in the legislature on this question. And there's damn few in Congress. And the real question here is, whose side are you on in this class struggle? Because the truth is that Obamacare was a direct attack on organized workers. It was a direct attack on union group healthcare plans, which is the main reason why people join unions. And Mark referred to this. This is obviously a reason some of my colleagues are exactly so. We don't want to give that up because that's why people join the union. You can get better benefits. And that's really true. A non-union hotel worker joining Local 5 can save $600 a month on family care right off the bat. Okay, that's just it. And that doesn't count the retirement, medical, the 100% hospitalization, and all the other benefits that we provide by having a strong group able to function in the marketplace. Obamacare was an attack on us by corporate Democrats. It was an attack on healthcare funds like mine, who do the best job of providing healthcare. We're a nonprofit, we're a multi-employer, we're a big group, we're able to bargain as a group, we're able to get better deals from the hospitals and so on. We're able to provide a better benefit for cheaper. We are a nonprofit, we have a cheaper employment base. Obamacare was set up to destroy us. When you set up an individual mandate, what that does is exactly what Mark pointed out. What they did in Obamacare was they set up all these little corporate risk pools. And we had to go to them to get insurance. You know, they put workers on a single market facing the corporate giants as individuals. And then they taxed us, our healthcare fund, to pay for that. So basically what they did was take from workers and give to other workers, and the intent was to drop down the coverage level for everybody. So we are very fortunate here in Hawaii that we have an exemption from Obamacare. Otherwise we would have had 70-30 plans and 60-40 plans in this state 2 years ago when Kaiser tried to institute that and went to the Prepaid Healthcare Enforcement Board and asked for that. And in fact, one of the things we have in Hawaii is a floor standard, a community standard. You can't sell a 70-30 plan legally in Hawaii. And you can't sell large deductible plans in Hawaii. These have been dealt with in our law. Now, our law ain't perfect, but I'm really glad we didn't get stuck with Obamacare. And there was good reason for the state exchanges to fail in this state because the volume isn't there. The fact is, we ran the numbers, we could have covered, meaning this community could have covered every uninsured person for less than a cost that it took to maintain state exchanges here. The state exchanges were ways to force workers onto the healthcare market as individuals where they're helpless. Okay, so we had no friends in the Democrats here. We spent all of Obama's period trying to amend that law, and every single time Obama's people basically pushed us away. They had no interest in maintaining employer-sponsored health care or multi-employer-sponsored health care through the unions that have been the most successful model. Now, I'm in that position that Mark described. I run a large trust fund. We are allied with several other large trust funds. We bargain in the market. So I think that Doc's right about single payer. The savings that are there from taking away all this coordination. Right? Every day we have third-party cases where we've got to fight with other insurers, no-fault insurers, who goes first, who's secondary, who picks up what plan. That's the lawyers, that's everything, all the costs of that litigation, all the costs that was described, all the clerks fighting each other, that's all true. But it's also true, and this is what Obamacare's big failing. They did not address the real cost drivers in health care. And those cost drivers are simple. Corporations. Obama gave pharma a buy. And you just saw that scandal, right? Didn't that guy just get convicted for, what, a 4,000% increase on insulin? A drug that's been out there for 90 years. Suddenly it has a 4 times higher cost. Why? Because they can do it. Because there was no effective cost controls put in on pharma. Or hospitals. Because hospitals are great. They'll give you a deal on this and this. If you don't have a line item on that fee schedule, they whack you. So if you don't have an outlier provision like we do that limits their costs on all the things that we haven't bargained a line item for, they hit you with it. Okay, so for-profit hospitals, for-profit healthcare system that Mark referred to, definitely alive and well under Obamacare. So the question is, where do we go forward? And I was at a panel where Doc spoke some months ago about single payer in Hawaii. And I am a big fan of single payer. Single payer is, from a mathematical standpoint, it's the only thing that makes sense. Because in insurance, it's all about risk pool. And the bigger the risk pool, the more you spread out the risk. And if you set up a system where the young and healthy can get out, and the old are stuck in, your cost goes up. So what did Obamacare do? An individual mandate, and they charge you $2,000 to get out of it, but it costs you $12,000 to be in it. So they set up an incentive for adverse selection, which made it impossible, in essence, for those plans to succeed. So I'm for single payer. It's the biggest possible risk pool. You get in when you're born, you get out when you die. Nobody gets in and out otherwise, right? You have the whole population. Now, as the population gets older, you still have a demographic problem. But you don't have an adverse selection problem taking the young and healthy out. You know, like me, you know, for 20 years, I didn't go to the doctor hardly, but my dad was in there. That insurer needed me to cover him. So risk pool is mathematics, guys. It's not Democratic, it's not Republican, it's not union, it's not management, it's math. Either we have a big risk pool or we don't. Either we have everybody in, or we don't. And if we don't, then we have small risk pools that are more and more expensive because the young and healthy have a chance to get out.
So speaking of expensive and risk pools and taking money from the workers to pay for the workers, that's a good segue into our question 1, which is, you know, how would a single payer system be financed? So we kind of danced all around that.
Well, it's taxes. Look, I mean, single payer, look, I'm no great expert on single payer. We do have locals in Canada that are working in that environment. They do have trust funds. They do negotiate contributions, and we get better. But it's basically a tax vehicle. The government takes over the insurance and provides it. So, you know, you get taxed on it. You're taxed on your income. Employers are taxed in various, you know, I'm sure other people have better detail. But then the government also provides the insurance and has the muscle to do cost control on the providers, just as they do today with Medicare. Now, they don't do it well, but they put a cap on Medicare costs. And that cap on Medicare costs is what we all use to peg our deals. So when we get a deal with Queens, it's like, okay, we'll pay you 20% higher than Medicare or something like that. So it's important to have that kind of price point that you work from. And the government needs to set that up in a single payer, and in fact, you know, sets it up in a single payer now through a Medicare reimbursement rate.
People worry about a huge government bureaucracy. Well, the way single payer saves money is by minimizing administrative costs. If it doesn't do that, it doesn't save money. It would be foolish to set up a single payer system and impose as much bureaucracy as possible, which is what the insurance companies are doing right now. It would only make sense if we try to minimize that bureaucracy. Well-functioning single-payer systems do not micromanage healthcare. They collect the money through taxes, they distribute it to hospitals, doctors, and other providers of health care, and they let them take care of the patient. It's much less bureaucratic in Canada than it is in the US right now. Administrative costs for a doctor's office in the US are 4 times what they are in Canada.
Something like a 30% cost markup or something.
So most single-payer proposals are financed with 2 big contributions and then some other little ones. The 2 big contributions usually are a payroll tax that's paid usually by, mainly by employers with a smaller contribution by the workers. So like the Conyers bill in the House is recommending, I think, a 6% payroll tax in addition to what people are currently paying for Medicare as a payroll tax. So employers would basically shift what they're currently paying for private health care, and they'd pay it through a payroll tax. Most employers that currently provide health care would end up paying a lot less than they're currently paying. Employers that, like Walmart, that provide almost no health care will be paying a little bit more, so there'll be equity there. And then the second big source of funding is some kind of progressive income tax, usually on the top 5% of taxpayers. And then there's usually proposals to capture other kinds of unearned income, like stock transfer tax and other kinds of taxes, to make sure that people who don't get their money through normal avenues of wages and employment are paying into the system. So, you know, like when the Labor Party developed the Just Health Care proposal back in the 1990s, we sat down with some economists and we said, look, figure something out where 95% of all Americans end up paying less than they're currently paying for health care. That's sort of so we had a political definition of how to finance health care. And I think that's going to be kind of the approach Bernie Sanders has taken. He has, when he introduced his bill, he said, look, right now there's no financing mechanism. He said, unlike the Republicans, we're going to have hearings. We're going to actually go to every state in America and have discussions with the American people about how we're going to pay for this. And out of that, we're going to develop a progressive financing system. So I think, you know, as Dr. Kemble keeps pointing out, I mean, the cost savings are there in a single-payer system. So you can cover everybody at less than what we're currently paying in a system. So the question is to construct an equitable system that makes sure people are paying their fair share, because employers are currently paying a big chunk. They're going to continue to pay in most visions, and then we build it out from there. I think that's sort of the simple answer to that.
Thank you.
The single payer is something that I agree, we need to work to that. I'm very nervous about single payer on a state level. And I mentioned this in the discussion we had with Doc earlier. We don't have the votes to do it right, guys. They'll screw it up. And right now we have the best law in the nation, and if we open that law, given the way that the legislature is working right now, it's not going to improve it. We need to keep that law intact while we try to get something better. But I don't believe that this legislature is going to effectively amend that law, nor do I believe the state here is able to administer a single-payer system competently. They aren't competent about administering the EUTF right now. And so, you know, so there's a lot to be said, but what I'm saying is, for the concept, we got to talk about what we actually do and what we can achieve. So I would point out 2 things. In Nevada, we have our largest single local, and it's a very big local in a fairly small state. We, after a huge effort, were able to pass a bill in Nevada that required the pharmaceutical companies to justify their cost increases, because they are killing us. I see the numbers every month. When we look at our numbers, it's pharmaceuticals that drive the cost of healthcare more than any other single point. And so, and this is not something, with all due respect, that you can trust doctors to control, since the pharmaceutical companies recruit the doctors in medical school, and there are many doctors who just prescribe and prescribe and prescribe. So we have to break up this domination in pharmaceuticals. And yet Congress has gone the other way and actually passed a law saying we can't even do bulk buy like every other country does, and get bulk buy prices from the farmer companies. We have to buy retail in every community, which is why so many communities would like to go and buy their pharmaceuticals in Canada, as opposed to in America. They all come from America, go to Canada and bring it back. And the hospitals, okay? You know, you guys all are watching the Maui Memorial conversion unfolding before our eyes. Well, it's fun, okay? It's fun. This is this privatization of the public facility because the public is basically saying, oh, we don't know how to do it, we don't want to do it. Well, Kaiser's doing it, and costs are going up, and that's just going to happen, right? Now it's corporate. So we got some things we have to do, but if there's one thing I would say we could actually have a chance to do here is go after the pharmaceutical costs. I can tell you, my employers would actually back it up because they got to pay it. Right? These laws basically take big money from this group of employers and give it to this group of corporations. So the fact is, you know, although I say it's a class struggle, and it is, you know, they're not united on this because within the corporations there are payers, winners and losers in this whole thing. And the guys that actually have to, you know, that we make pay for our medical, they're going, hey, wait a minute, we need relief. They would support us doing something like Nevada did, and California is trying on a broader basis. What California is trying to do is pass a transparency bill that would apply the same standard to all medical. So it's not just pharma has to justify their increases. The hospitals do, the providers do, all those guys would have to do that and show their numbers, which they don't want to do because they juice them all the time. So we can't have things we should do while we are building the power. But I would be very nervous on behalf of my members. I would be very nervous about monkeying with the Prepaid Healthcare Act unless we know we have the votes.
So we have about 2 minutes left. We got to one question, but you guys really did dance around all of the questions. Did you guys have any more final remarks, Dr. Kemble, Mark, adding to anything that are brought up?
I just want to say that we should band together with a bunch of other states, including California, to negotiate drug prices, because Hawaii alone doesn't have the market power to do much. But if we join with California, Oregon, Washington, Alaska, Nevada, we could do it.
And while we're bargaining with them, have a law that makes them show us the numbers. Because when you actually dig into the numbers, they don't match, guys.
Mark, any final comments?
It's wonderful to be here. You know, I kind of leave it to you all to figure out whether there's a path towards single payer in Hawaii, separate from the sort of national path. I'm not coming here to tell you how to move that. I think that the importance of the state fights for single payer right now is that they can spark and build momentum for the national campaign. Ultimately, we need to have one system in this country from Maine to Hawaii, where everybody is in, nobody is out, and wherever you go as an American, you are guaranteed the right to health care. That is will provide so much security and so much comfort to working class families in this country. I can think of nothing that would provide a better change in the lives of so many millions of Americans than guaranteed health care from cradle to grave. So it's a fight that we can win, and it's a fight for our lives. So let's get down there, roll up our sleeves, and make this happen.
If you enjoyed the program tonight, if you're here last year, enjoyed it last year, if you want to see LaborFest continue with these types of programs, we need your help. We need you to join our board. We need you to volunteer. We need you to help us plan the next one and the next one. We want to get bigger and bigger and bigger. So if that's something you think you want to do, please come see me after. I don't want you to leave without giving me your information because I will follow up with you. I do want to thank you all again for coming, and hopefully we'll see you next year. Thank you. Just like the ones that are on that are there now, if you could just thank you.